So if we're going to talk about the genitourinary symptoms of menopause, this is often shortened to GSM. This can involve vaginal or vulval, this is the external part, dryness, itching, soreness during sex, even with wearing jeans or sitting down for some women. It can also involve symptoms that seem to mimic thrush, but actually there's no thrush there. And it can involve symptoms of the urinary tract, so needing to pee more often, needing to pee more urgently, needing to go to the toilet throughout the night, disturbing your sleep, or even mimicking the symptoms of urinary tract infections. And actually it can increase your risk of getting urinary tract infections as well. And all of this is to do with the declining or changing estrogen in the vulva, vagina, urinary tract area. There's a lot of estrogen receptors, so sort of locked estrogen's key in that area, and so when estrogen starts to decline, it can have a massive impact. There are things you can do apart from estrogen to help with these symptoms, and actually having proper vulval care is the building blocks to managing these sets of symptoms. The first thing is how you wash, which really avoiding soap is crucial. So that sounds a bit strange, but soap is quite of an irritant. That's why it foams, it's quite chemical. So using either just plain water or an emollient, which is a medical moisturizer, as a soap substitute in the shower is really important. And then after the shower, you can use that same emollient as a moisturizer in that area, or you can get special moisturizers that are made for the menopausal vulva. Similarly, you can also have lubricants to use during sex, but make sure they're ones that are made for the menopausal vulva so that they're not an irritant. And then on top of that, you can also have some either locally delivered estrogen, so that's just estrogen that works in the vulva, vagina and urinary tract. This comes in many formats: pessaries, creams, even a ring that stays in, a pessary ring that stays in for 3 months, or systemic HRT. So this is your classic hormone replacement therapy that goes around your body. For a lot of women, that is enough to target those symptoms in the vulva, vagina and urinary tract. Some women need both.